In this video, I'm going to be discussing the retainer options that I offer in my office. We offer removable, clear retainers, and permanent retainers. Each of them serve a different purpose. They have different instructions. Hopefully this video will help you make a better decision about what type of retainer you want to move forward with. So let's go. Top left, we have the traditional Holly retainer. These are more durable. They last a very long time. I've seen some of them last 20, 30 years. There's a wire that goes across the front, so they're not as aesthetic as the clear retainer. On the top right, we have the digital clear retainer. These are more aesthetic. They don't last as long, maybe 2 to 10 years each. They are digital, which means that we can reorder them at any time. So if you move away, kids at school, we just print them up, send them to you, and that way you can keep having straight teeth in case you ever lost them. On the bottom row, we have the permanent retainer wires. Those are the bonded ones. These stay on the entire time. They don't come off. They're on the backs of the teeth. A little bit harder to clean, but with special flossers and a water pick, you're able to keep a very good hygiene, and therefore they could stay on for a long time. This is the traditional Holly retainer. There's a wire across the front. On the inside, some patients do choose a color that pops out just like this. There's no plastic that goes over the tops of the teeth. They are removable. They are durable. This does require compliance, meaning that you have to wear it for it to work, and they're just a little bit more noticeable because of the wire across the front. This is the clear retainer. We use the Invisalign brand. It's the best one on the market. It's made with lasers and plastic. As you can see, it goes over the tops of the teeth as well as the fronts and the back. The downside of these digital clear retainers is they need to be replaced every 2 to 10 years, depending on how well you keep care of them. The nice thing is they can be reordered at any point, anywhere. So if you're at college or moved away, we can ship them out to you. They can also be used as teeth whiteners. So you just put the whitening gel inside these trays and then you can wear them overnight and whiten your teeth. 40% of all my patients choose the permanent retainer wire option. They choose this for reasons such as convenience, long-term stability. They want to keep their teeth straight with minimal effort. The wires are on the inside of the backs of the teeth. They stay on for 5 to 20 years. Another reason patients choose the wire is for teeth relapse and stability. If the teeth were very crowded to begin with, or if one tooth was really in or out, the permanent retainer wires really hold them in place to prevent any relapse. These wires go behind the teeth, so they're very aesthetic. The downside of these wires is it's harder to clean. I do recommend a water pick or a water flosser, as well as threader floss made by Glide. You could also use those interdental brushes. They look like pipe cleaners. Using all 3 of those cleaning options will ensure that your teeth stay clean with the permanent retainer wire. The retainer wires used today are much less prone to breakage. The reason for that is technology's gotten better, the glue has gotten better, and therefore the retainer wires stay on longer with less issues. The lower retainer wire goes on the back of the teeth in a non-contact area, and therefore there's very little issues with the lower. The upper retainer wire is a digital design. The one we use is called a Memotane wire. It's custom made, robotically bent, made in Germany. This is the reason why there's an extra fee for this retainer. It's a special order. The reason for this special retainer wire order is because the upper teeth are not flat, and therefore we cannot lay a flat wire. If you look at the top right image over here, you'll see that this wire has a lot of curves in it. Those curves go along the anatomy of the top teeth, which is not flat. When we look at the bottom photo, you'll see that the lower teeth are flat, and that's a wire I make myself. So there's no extra charge for the bottom one, whereas there's an extra fee for the top one. Orthodontic treatment is an investment in yourself, and we want to protect that investment by keeping the teeth nice and straight. So these are the options we offer our patients. For our braces patients, 2 sets are included. The second set is going to be the digital clear retainer. Remember, that one can be reordered at any point in the future. So the only decision you have to make is between the traditional retainer and the permanent retainer. The lower permanent retainer is included at no additional fee. The upper permanent retainer is the one made in Germany, and there's an extra fee for that one. The traditional retainers are fantastic as well. They last a very long time. We even have some patients that mix the two, so they'll go with an upper traditional retainer and a lower permanent retainer wire. For our Invisalign patients, we offer the 1 set of the Invisalign retainer as well as extra passive duplicate trays of the same retainer, but it's not the same thickness as the retainer, which will last you 2 to 10 years. Those passive trays are flimsier. They are the same trays as the Invisalign active moving trays. We have the same options for the upper and lower permanent retainer for the Invisalign patients. The lower retainer is no extra fee. The upper retainer is the one made in Germany. There's an extra fee for that. The reason to do a permanent retainer is based off of stability of the teeth, the amount of crowding, as well as convenience for you. Extra retainers can also be purchased. Invisalign offers a package of 4 retainers or 1 retainer. We'll go over all those options when you get your Invisalign attachments off. Removable retainer instructions are as follows. I recommend retainers to be worn 16 to 18 hours a day for the first 6 months. Then it's nighttime only, or 8 hours a day going forward. You'll be doing the nighttime until teeth are fully stable or growth is completed. For teenagers, growth is usually completed around 22 years old. So you're going to be doing retainers at nighttime until 20 to 22 years old. However, some people need to wear retainers forever. Nighttime for a lifetime is the philosophy. If you want to maintain your teeth straight forever, some people can stop wearing the retainer when growth is completed or after a few years, like 5 or 6 years. And those people do have stable teeth, and that's okay to reduce your retainer wear to nothing. When the retainer is not in your mouth, it should be in the case. Do not wrap your retainer in a paper towel. That's the easiest way. People throw it away, especially at lunch. Do not boil your retainer. Warm water is okay. Do not use denture cleaner. You're going to use toothpaste or dish soap. I do recommend the hydrogen peroxide based toothpaste, and definitely keep it away from any dogs you have at home. They like to chew on the retainers. The main instruction for the bonded permanent retainer wire is just to keep it clean. It is more difficult because there's a wire between the teeth, so you cannot floss all the way down. However, if you use a threader floss or water pick or the interdental brush, you can absolutely keep your wire clean. And so let's go over a little bit more in detail. The Oral-B threader floss is designed to go underneath the wire between the gum tissue. It's the only way you're gonna be able to get into that area. With floss, regular floss is too flimsy and will not work. The easiest and most effective way to clean below the wire is the water flosser or water pick. I do recommend a cordless version because you're gonna use it more if it's cordless. I also recommend bringing it into the shower because it does spray water everywhere. The idea is you're going to shoot some water between the teeth. That way you're displacing the food, and it does a very similar effect as flossing. Some patients have a little extra room for an interdental brush. This is like a pipe cleaner. It effectively cleans just as good as flossing and brushing. These are some common questions that I get about retainers. Number 1, why do I need to wear a retainer? Orthodontic treatment moves teeth to a new position. Gum tissue has memory and it wants to pull the teeth backwards, so a retainer will help keep the teeth in their new position. Number 2, how often do the retainers need to be replaced? Clear retainers can last anywhere between 2 and 10 years. I've seen some last longer, but on average, 2 to 10 years is generally the right amount of time. Traditional retainers can last literally forever as long as you keep good care of it. I've seen some last 30 and 40 years. They're very, very durable. Bonded retainer wire, same thing. They can last decades as well, depending on how well you keep care of it and how well you can clean your teeth. Number 3, what if I get new dental work or a new dental crown? If it's a clear retainer, those usually need to be replaced because the retainer no longer can seat all the way down because it's new dental work. You're changing the shape and size of the tooth. If it's a traditional retainer, you can usually make a small adjustment within the retainer and it would still fit. If it's a permanent retainer, as long as it's not in the area of the permanent retainer, no effect on the permanent retainer. Number 4, if I get a permanent retainer wire, why do I have to wear a removable retainer wire? Well, the permanent retainer wires are only on the front 4 or 6 teeth. Therefore, nothing is covering the back teeth. So a nighttime only wear for the first year is good to help keep the arch shape and the arch width. Number 5, how do I clean a retainer? Every time you brush your teeth, you're gonna wanna brush the retainer. You can use toothpaste or dish soap. I do recommend hydrogen peroxide based toothpaste to keep it nice and clean. If you get those little white crusties on the retainer, then you're gonna soak it in distilled white vinegar for a few hours and then brush that off. Let's go through a few patient examples so you can make a better decision about which retainer option to move forward with. This patient has lower incisor crowding, with the lower left incisor being the one that's most inside. This tooth is the one that's going to be most likely to relapse. I could go either way with either a removable or permanent wire. This patient chose the permanent retainer wire because it's the most convenient, and then that way the teeth won't move. This patient had upper spacing and rotated lateral incisors. Lateral incisors are teeth that are most likely to relapse, so they went with a permanent upper retainer wire. That's the Memotane retainer wire, and that way the teeth won't move going forward. This patient corrected a double incisor crossbite. These teeth are very difficult to move. He did an amazing job with the Invisalign, which is a compliance-driven system. I gave the option of doing either a permanent or removable retainer because the compliance was so good. This patient decided to choose a removable retainer to keep the teeth straight. They are still straight. I support that decision. If this was a braces patient or they didn't want to worry about keeping the teeth straight, then I would have recommended a permanent upper retainer wire. This is an adult patient with rotated upper central incisors. Gum tissue has a lot of memory, especially in an adult. It's very difficult to keep the teeth straight, and so therefore we recommended the upper permanent retainer wire. This adult patient previously had orthodontic treatment where the lateral incisor relapsed and went backwards. This time around, we did recommend a bonded upper retainer wire so that way the teeth don't move and go backwards. We want to avoid orthodontic treatment for a third time. Sometimes when there's a big space between the upper two front teeth, also called a diastema, we do recommend a permanent retainer wire bonded to hold that gap closed. It's very difficult to keep that closed with a removable retainer. This patient had deep bite and crowding. We fixed his teeth in about 11 months. We gave him the option of both a removable and a permanent option. He chose the removable option. His teeth are still straight. He's got excellent compliance, so no issues keeping the teeth straight there. This adult patient has a lot of crowding and rotations on the lower anterior teeth. These teeth have a very high relapse potential, and so therefore I'm going to recommend a permanent upper and lower retainer wire. As far as the upper goes, I could have gone either way, but the lower is the one that I insisted on being a permanent retainer wire. This Invisalign patient had a lot of crowding and expansion with his treatment. He had excellent compliance, and therefore I could go either way with a permanent or a removable retainer. He went with a removable retainer. So just because you have an incisor and you're an adult doesn't always automatically mean a permanent retainer wire. If you have very good compliance, that is another reason just to go with a removable retainer because it's easier to keep your teeth clean. This patient wanted the easiest option to keep his teeth nice and straight. We did the Invisalign in 10 months to straighten out the teeth, and then we finished with upper and lower permanent retainer wires. This patient had one tooth that was on the inside, this lower right lateral incisor. Now that it's glued and bonded together, those teeth can't move, and he's got a straight smile going forward. Thank you guys for watching the retainer options video. Hopefully you guys found it useful. Hopefully it helps you make a decision on what kind of retainer you want to move forward with. As always, please like and subscribe the video, and I'll see you guys in the next one.